First, I'd knock on the patient's room. Hello, my name is Izzy. I'm going to be your nurse today. Today I'm going to be doing a wound packing on your wound site. It should take about like 10 to 15 minutes. Do you have any questions? No? Okay, I'm going to come to this other side. And can I have your name and date of birth? Jamie Smith, 1/1/1982. That's what I have too. And do you have any allergies? No? Okay. Do you have any specific allergies to any cleaning medication or anything that would have to do with this procedure? Any tape or anything? No? Okay. I'm gonna make sure my table is at waist high. I can put down this bar as well. And I'm gonna bring him up a little bit so I don't hurt my neck. Okay. And then I would make sure all my stuff is here. Make sure I have everything okay. Then I'll put on clean gloves. Also, something I realized I forgot was to do hand hygiene when I came in the patient's room. But I would also do that as well. And then I will clean this table. And then clean the outer edges as well. And I will make sure it's wet for however long it says on the label, which is 2 minutes. And then I'll remove these gloves, perform hand hygiene, and then put on some new gloves for taking off the wound. And I just asked my patient again, are you in any pain right now? No? Okay, if you get in any pain, you can just let me know. Okay, so I will take off and uncover the gown and then keep the rest of him covered. That doesn't need to be shown. And then I will remove the wound. And I'll make sure to hold down, make sure no skin is ripping off. And I would check for any drainage or anything on here. It's clean, so I can just put it in the trash. I don't have to put it in the biohazard, like if there were blood. And then I will remove these one by one, assessing for any drainage or blood. Okay, and there's none. And then I would look at the wound and assess Rita. So there's no redness, there is no edema, there's no ecchymosis, which is bruising, there's no drainage, and it is not accommodated because it is a wound packing, so it's open instead of being closed or approximated and accommodated. Okay, and then next I will take these gloves off. I'll perform hand hygiene again. And then I will place my stuff. So I'm going to put this here in case there's any drainage or anything that were to come from the patient, it wouldn't get on me. And also I'd wear any PPE that is needed, like if I need a gown or anything, I would wear that. If I had heard that there was like a lot of drainage coming from it. And I have my biohazard bag here. Okay, and then to get this out, I will use, I'll put gloves on. And then in this bag, I have sterile scissors and tweezers, so that is what I will use to take out the packing in the wound. Okay, and I will pull this out, looking for any drainage, blood. Also looking for how long it is so I know how much to cut. And then that will go in the biohazard bag, and this will go in the sharps. I will actually put it in there in case it needs to be used again. But if it was a real situation, I would. And then I will remove my gloves and do hand hygiene again. And then now I'm ready to open my tray. I'm gonna move this over here. And then this can go in the trash. And then I will open it away from me, side to side. And back. And then I have like a 1-inch margin of what is sterile versus not. And then I'll put my sterile gloves over here. And I'll use my fingertips to flip on there. Maybe this one's come out. Fine for now. And then I'll use this saline. And I'll put my hand on the label. The first pour will be in the trash. And then I'll put some in this one. And then this one. And then cover this up. I'll open my strips. And then I will glove. And then anything that touches this border will also be not sterile. Okay, and then I'll move this off. And now my hands are sterile, so I can move anything that needs to be moved around in here. Okay, and then I will take 3 of these gauze pads and put them in the solution. And then I will take the tweezers and reach in and get steri strip. And then try and cut it as long as the one before was. Okay, and then I'll put this in this one. And then while that one's getting wet, I'll start cleaning. So I'll just make a little ball with this and clean from, so I'll do inwards first and then slowly move a little bit outwards. And if there was any like redness, edema, bruising, drainage or anything that happened during this point, I would reassess for Rita, but there isn't, so I'm good. And then the outmost layer. And then next I will take the Q-tip and I'm going to make sure there's no extra saline on this. And then I'll wrap it around 1.5 and hold this side. And then I will place it in here, try not to touch the skin. And then I'll leave a tiny part of it out. Then this will go in here. And then I will put these 3 of these pads on, the dry ones. And then I will put this packing over it. And use tape. And since it's already covered, I don't have to be as sterile as I was before. And we can either cover 3 or 4 sides. I'll do 4 just because I feel like it's an extra protection. Okay, and then I'll take the extra strip and then I will grab my pen and write my name or my initials and then the time and then the date and then also when I would have taken the packing off, I'd also check for the person before to see what time and date was taken off, who did it, just so that I know if I'm good to take it off, make sure someone didn't like remove it and not document it. Okay, and yeah, then I would just close everything up, make sure my patient, ask him if he's in any pain right now, do any assessments that need to be done. And then I would cover him back up, make sure he doesn't need anything. This bag would go in the biohazard bag. just clean up all of this and be done. Thank you.